Medication non-adherence is coming at a massive cost to the Australian economy. Globally, the healthcare system is losing out on around $500 billion per annum.
8% of healthcare budgets can be eroded if we get medication adherence right.
Only 50% of medications prescribed in Australia are taken correctly, putting pressure on emergency rooms and GPs. It's also resulting in thousands of deaths each year.
Recent studies in the US showed that there are up to 125,000 deaths per annum based on medication mismanagement or non-adherence. And if you put that in an Australian context, that works out to be about a 747 crashing every 2 weeks.
In an era of rising health technologies, MedAdvisor doesn't sound like anything new. But apart from being a medication management tool, the smartphone and tablet app is connected with an individual's chosen pharmacy. It allows their pharmacists to have direct access to what medications have been prescribed, when their scripts need to be filled, and the timing of their next GP visit. It even has a tap and refill feature, which means you can pre-order your medication and pick it up without waiting in line.
A lot of our patients are a bit older, but that's no barrier to technology.
Similar apps such as MedCoach, Medicine List and MediSafe require the user to manually enter their medication and the times to take it. MedAdvisor, however, places more responsibility on the pharmacy, with pharmacists having to enter the information and being alerted to patient updates. More than 25% of Australian pharmacies have signed up to MedAdvisor, with pharmacists saying it's helping them keep track of their patients' prescriptions and keeping people out of hospital if they're reminded to take their medication. The company's founder says the idea was inspired by his own experiences.
Seeing my mum struggle to manage over 10 long-term medications. She suffers from Parkinson's and rheumatoid arthritis, so she's on quite a spectrum of medication. Being able to give her a tool that can help her to organise all that and keep that on track was extremely valuable.
Users appear to mostly like the software too, with only 1 out of its 20 reviews in the App Store giving MedAdvisor the thumbs down. The Pharmaceutical Society of Australia isn't too convinced though, with the Victorian branch president Benjamin Marchant saying at the end of the day it's the patient's choice on whether they'll take their medication. Although anything that helps with medication adherence can only be seen as a positive as long as the patient's privacy is protected. Improving adherence can have significant benefits to the patient as well as overall health system in terms of reducing chronic disease complications resulting in hospital admission. On the expansion front, MedAdvisor says it plans to go global, starting with an IPO. The group will raise $5 million in capital and list on the ASX by early October.
The fundraising efforts are well and truly underway, and we're really excited about what that can do for MedAdvisor.
But the chief executive was reluctant to say whether he thinks the stock price could ever compete with some of the bigger players in the healthcare sector, like Cochlear, Ramsay or ResMed.
We'd hope it would head in that direction, Jade, but certainly we're not putting forecasts on the stock price.
MedAdvisor is available to patients free of charge through pharmacies who pay a monthly subscription to access the technology. Jade Kotick, Sky News Business, Melbourne.